For today's topic, I wanted to discuss something that's been on my mind for a while, and it really, really bothers me. Let's talk about women's propensity to toss around clinical diagnoses as if they have a license to practice therapy. So, the moment a woman starts diagnosing you, the relationship and her accountability stop being about whatever your disagreement is, and it starts being about you.
Because what happens is also when you're dealing with a narcissist, you are under witchcraft.
I'm going to break down why male narcissists convince themselves that they're not gay.
The truth is that narcissistic or trauma or psychotic are all terms that she cannot even professionally describe. She's neither trained nor qualified, and when she uses terms that should be reserved for professional counseling or therapy, she's definitely not helping. She's using clinical-sounding language to put you on the defensive and to control you. Today, I'm talking about the real clinical aspect of mental health diagnoses, why you should avoid women who use them, and how to shut it down if you're already with one of those women. If someone calls you stubborn, sure, that's an easy one. You can shrug it off. But being labeled as narcissistic is a very different story altogether, and it causes you to defend your character. Similarly, being called forgetful, right, is a very small thing. But gaslighting? Now you're fighting for your integrity. Let me break down the diagnoses part for you. To be clinically diagnosed with narcissistic personality disorder, NPD, one needs to overtly express a pervasive pattern of grandiosity, need for admiration, and a lack of empathy, typically beginning by early adulthood and present in a variety of contexts, and to meet at least 5 of 9 diagnostic criteria that I'll put up here on the screen for you. Feel free to pause and have a look. For a diagnosis of narcissism, these traits must cause clinically significant distress or impairment in social, occupational, or other areas of functioning. Similarly, borderline personality disorder, BPD, is assessed as a pattern of instability of interpersonal relationships, self-image, and emotions, and marked by impulsivity, also often beginning by early adulthood, and must also meet 5 or more of these criteria, again, that I'll put up on the screen for you. And again, as with all personality disorders, symptoms must cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. When those words get thrown at you in a relationship or in TikTok rants that you watch, they're used as weapons of controlling and manipulation. She's not carefully considering your personality structure to better understand how you operate. She's probably upset, not getting her way, and she's using words that she picked up from TikTok, Instagram, or the latest therapy podcast to justify her lack of accountability and ability to self-reflect. Because she knows that those words will put you on the defensive. And once you start fighting to prove that you're not what she's labeled you, you're in the role that she set for you, the problem to be fixed. This is exactly what psychologists refer to as concept creep. It explains that over the last couple of decades, psychological terms that once had very serious and precise definitions have been structured and stretched and diluted until they're used in everyday arguments and they really hold little value. Narcissism is used to mean a clinical personality disorder that affects 1% of the population, diagnosable by trained professionals. Now, it means nothing more than you didn't pay enough attention to her. Gaslighting used to mean a calculated effort campaign to make someone doubt their own reality. Now it means that you refuse to agree with everything she says. And trauma? Trauma used to mean battlefield shock or some type of catastrophic loss. Today, it means nothing more than she's offended. These words have stretched so far that they barely resemble their original meaning. Let's say a woman calls her boyfriend emotionally unavailable because he didn't want to text paragraphs about his feelings every night. Emotional unavailability is a term that therapists use to describe a consistent, long-term inability to connect emotionally. But that's not what happens in the example that I just gave. He's just tired after work and he doesn't want to write an essay when it's time for him to turn lights out. But the moment women spew that phrase, it's an attempt to make men feel guilty, like maybe it's something really is wrong with them. And what often happens when you accept any clinical label is that you start trying to fix a problem that does not exist. And how about these other terms? Who hurt you? Hurt people. Emotional abuse. He triggers me. To end this cycle, the next time you get pulled into a conflict in which you should be addressing her amateur therapy session, ask her how she came to the conclusion of your diagnosis. Seriously, ask her under what cluster your so-called disorder is classified. Ask her exactly which of the diagnostic criteria your behaviors meet. Ask her for how long you've been exhibiting them, and ask her how they've caused significant distress or impairment in your own social, occupational, or other important areas of functioning. And then do not say another word until she answers, and answers correctly. Now, if you really want to drive the point home, after she's standing there in stupid silence with a baffled look on her face for a minute, say to her, "You know what your accusations and inability to respond sound like to me? It sounds like self-importance. It sounds like preoccupation with brilliance, sense of entitlement, arrogance, and interpersonal exploitation." That's 5 of the 9 criteria needed for an official diagnosis of narcissistic personality disorder, and you showed all 5 to me in the past 10 minutes. Seriously, put her in her fucking place. The bottom line is that she's not your therapist. She's not trained. She's not qualified. And the terms that she's throwing around are misused and uninformed to control you. They're diluted versions of real mental health issues. So stop letting her amateur therapy sessions dictate your relationship and ruin your mental health. Call it out without apology or guilt. And if she won't stop, then just leave and never speak to her again. Because you're not her patient, and you never should be.